Good afternoon, everyone, and welcome to Breaking the Language Barrier for LEP Patients and Clients During COVID-19. My name is Jason Hicks. I'm the Director of Learning and Development with Credible, and I'm pleased to welcome our guests, Kirsten and Hans, who are going to be presenting to you in about another minute. Just wanted to go through a couple of housekeeping things. We are using the GoToWebinar application. In the GoToWebinar control panel, you will see that you're muted, and you'll remain muted the entire presentation. However, we want you to interact, and we value your questions. So please use the questions box in that GoToWebinar control panel and type those in for us. We'll respond to those at the end of the presentation if we have the opportunity. If we're not able to address your question live during the webinar, we will be looking through our report on those questions and getting back to you with an answer as soon as we can. We are recording this presentation as well. Our guests will let you know how you can gain access to that recording at the end of the presentation. Without any further ado, I know there's a lot of great content. I want to welcome Kirsten Brecht-Baker, CEO of Jeanie, to present to us today. Kirsten?
Thank you very much, Jason. I'm here. I'll just do a quick introduction then. And Hans, if you can proceed with the slides. Thank you. So I'm online here with Hans Fenstermacher. I'm the CEO and co-founder of Jeanie, and Hans is our Global Talent Ambassador. And we are very happy to be here with you today. We want to thank Credible so much for inviting us to join them on this webinar at this very kind of critical time and get the information out to you. You're all familiar with, I think, our topic today, so we're going to dive right in to the agenda, and we will move in the next 45 minutes through the following subject areas. We'll first talk about the impact of language barriers, generally speaking, in the general kind of healthcare and behavioral health space. We will then focus specifically on what the exponential effects have been with COVID-19. Then we'll talk about language service options and what you should be considering when deciding how you can employ these options to work with your limited English proficiency and deaf patients. And then we'll give you a little bit of information about how we as a company are looking at some of those options and try to serve as a solution. So starting off, we're going to do our first poll question for you before we get going. Is how many of you have experienced problems with language barriers when working with limited English proficiency clients or patients at your location or during teleconsults? Well, it seems like there is a lot of reason for people to be on this webinar today. Thank you very much for your answers. We'll have a couple of more questions here as we go along, polling throughout the presentation. But let's first dive in now into impact of language. And we're going to look at this from 3 different levels. We're first going to look at this from the standpoint of, a context, if you will. This is what most people are unaware of, a multi-billion-dollar problem in U.S. healthcare right now. And that is affecting all the different kind of layers. We're going to talk about how it affects specifically clients and patients, as well as caregivers, as well as healthcare provider and agency owners. But you see here that there is actually a very large percentage of the U.S. that not just has uncomfortable English skills, that they don't necessarily use English at home as their first language, but literally they have a very limited ability to kind of communicate in English language, especially when it comes to subject areas like healthcare, where medical terminology gets more difficult. So these numbers, tend to kind of surprise people. And as you can imagine, this kind of an impact in U.S. healthcare has had a very interesting impact across the industry, where we see now billions of dollars every year in insurance claims being paid out because of mistranslated or misinterpreted language issues in the healthcare space. And it's worth noting that this is actually pre-COVID. And every report that we're getting in right now, and we'll discuss that in a minute, shows those numbers just kind of increasing over the industry. So first, let's talk about what is the impact of language barriers on limited English proficiency, LEP, we'll refer to them going forward, and deaf individuals, clients, and patients. I'm not going to read through this entire list, but we did bother to kind of let the list stay long so that it drives home the message that there are of impacts on individuals. And obviously that starts from the very obvious inability to communicate symptoms and feelings, and what kind of emotional impact that has, all the way through how it affects the relationship with caregiver, and a lack of sort of trust there, and uncertainty around what's been told around diagnosis or treatment protocol. It also affects the patient or individual client's willingness to ask for more information, to ask questions. And what is one kind of critical point here we do want to point out, after we sort of highlight the fact that all of those different things I just mentioned obviously lead to an increased recurrence rate or readmission rate to hospitals. One important fact here is that you often see, probably in your practice, individual clients and patients who will bring friends and family with them to do interpreting. And when we have polls and when we have surveyed and done focus groups, on average, patients and clients do actually they do not prefer having friends and family members come along with them for interpreting on average. And a lot of times that is because the privacy component of that always feels very awkward to them. And there are certain things that they're really not necessarily wanting to share. And then of course, all of these culminate into higher medical bills for clients and patients and more time out of work. Next, let's look at the impact of language barriers on caregivers and agency staff. So there is, if you're a caregiver and you're having a barrier to communication, you're already kind of suspicious around what you're getting in terms of information on symptoms. Are you getting this kind of full, picture? And if there are friends and family who are there doing the interpreting, you don't have a lot of sense of confidence necessarily that, they're understanding, or that they're kind of giving you the appropriate information and accurate information from the client or the patient, the way the client or the patient would describe it. So that therefore kind of translates into a lack of confidence, or even potentially fear of misdiagnosing. And then when you come to the treatment protocol, you tend to have a little bit less of a vision on whether it's being adhered to. There's a lot less kind of ability to communicate with the client or the patient quickly and regularly, because you're often waiting for interpreters to help to kind of intercept or facilitate those conversations. And naturally, this all leads to a kind of heightened sense of risk. And for healthcare providers and agencies, all of this sort of starts to roll up into, what ultimately become decreased success rates, longer treatment cycles, higher rates of recurrence, lower patient and patient family satisfaction scores, all again culminating into increased operational costs that result from the inefficiencies. And then there's just risk of insurance claims, as we were talking about at the beginning of the presentation, from misinterpreted information being passed or not passed during the patient, client, physician, caregiver interaction. So now let's dive into specifically now, what does this mean in the day of COVID? What happened here in the last few months? And go ahead, Hans, and hit the next slide here. We're going to start by first asking our next polling question, which is, have you seen a difference in the number of limited English proficiency patients or deaf patients and the challenges associated with that since COVID-19 in your practice? And we ask that because we as a company have seen a tremendous uptick in requests for need for language support. In general, I think that, as we'll talk about in a minute, has a lot to do with the activity levels across the board. This virus obviously does not, know, is not partial to whether you're an LEP patient, client, or not. Okay, interesting. So it's a kind of a 50-50 split there. So let's talk about then the impact of, moving on to the next slide, to what we see in the time of COVID-19 specifically. And Hans, if you could move to the slide that shows the impact on individual clients and patients in the face of COVID-19, please. Okay, I think we're still in the poll. If we could close out the poll, and then we could see the presentation again. Hans or Jason, maybe you can help here.
I apologize, I'm having some difficulty with advancing the slides. One moment, please.
Thank you. Well, I'll tell you what, let me just start kind of talking a little bit about, the changes that we see as a result of COVID-19 that are affecting individuals and patients. In general, there's no question that across the board, there's just so much more activity because people are seeing doctors who just don't normally see doctors. And what's very interesting actually about that is a lot of the people who don't normally kind of see their caregivers or their doctors are actually coming from a large uninsured population, and there is a higher percentage of LEP and deaf patients in the uninsured patient population actually than there are in the insured population. So we definitely see this impact of the more visits to general caregivers, and we're, naturally that is a product of the fact that if you're a limited English proficiency patient or client, you also have less access to accurate information around prevention, symptoms. Unfortunately, you're often percentages right now in surveys that we're seeing show a higher risk to the population because of a need to continue to keep working. So the ability to shelter in space and at home is not nearly as attainable. And these are all kind of resulting in augmented mental health issues, anxiety and depression and others. And then we are also seeing more visits to urgent care. And there is less access to insurance. If you could just, here we go, less access to insurance coverage. And as I mentioned, a larger population of the uninsured are LEP clients and patients. And then what we do see here is an increased need for language help. And a lot of that has to do with numbers. It has to do with the subject of the conversations being much more complicated and very kind of emotional, full of this heightened risk and anxiety, and the inability now to have family and friends with you when you go into certain environments because of social distancing. And I think we'll go to the next slide, which is the effects of COVID-19 here on caregivers and provider staff. So again, when there are more clients and patients visiting a location, environments become very, very stressful. But now with social distancing, we have seen that there is a very limited, if not no, access to in-person interpreters. In-person interpreting, as many of you probably know, in clinic settings and in hospital settings is become too risky for the interpreter, for the caregiver, for the client. And so that's not, the option that it once was. And while a lot of our caregivers now and provider staff are working from home, also as a result of social distancing, we see an added sort of operational issue of migrating to telehealth platforms, but while still dealing with this increased client-patient activity and needing to kind of, you've got more numbers of people and you've got sort of more issues for each person you talk to, and yet now you're needing to kind of figure out multiple media in which to have those conversations. And so language services, again, becomes, what was an issue already, an even bigger issue because communication is so central. And so if you have more LEP clients, more deaf clients, and now more complicated things to talk about, Now you have to figure out sort of how to have those conversations with interpreters in a telehealth environment. And finally, the effects of COVID-19 on healthcare providers and agencies is obviously it's a very stressed operation. Right now with all the, increased client-patient activity and the anxiety, really for both caregivers who are personally, at risk often for the virus now and patients who are uncertain. You're worried about your staff. You're worried about the fact that you don't have access now to in-person interpreters in order to facilitate a lot of those conversations. And so people are really kind of trying all the time to sort of make do. And we're hearing about making do, with personal protective equipment on the news all the time and everything else. But this is an environment of making do. And then for the agencies and providers, there's also been this kind of, a need to quickly migrate caregivers and individuals over to a teleconsulting model, figure out how you take literally your whole operation. We've talked to, quite a few of you over the last few weeks who have successfully and heroic operations and there is a need for easy access here in all of this now for interpreters and language again. More necessary kind of communication, as we said before, between the caregivers, clients, and patients, and that burden is very much kind of falling on healthcare providers and agencies to figure out how to provide that. So here's our third polling question. Have you, at your location now, already migrated your operations to a virtual telehealth model? Have you already had to do that? We've talked to kind of many of you who are attending today, and we haven't talked to many of you who are attending today. And I can see, even just looking at the numbers right now, that it is incredibly high. I mean, this is, 9 out of 10 of you look like you have already had to migrate into a telehealth model. And kudos to all of you, because that is really, really, quite something to have to do in the midst of all of this, is to shift your operation. So moving on to the next phase, and we'll kind of dive in here to a little bit of a summary then. Why, language services? I mean, if we haven't sort of made that case yet, what we're trying to kind of impose here is a need to ask a question about what the impact can be of eliminating a language barrier and improving communication. And, look at all of the different studies being done right now. We were just having a conversation the other day with Harvard Medical School and Partners Health and some of the studies they're doing. The ability to improve diagnoses and therefore to get treatment right, and therefore adherence to treatment and success rates, it's exponentially higher with the ability to communicate. And when you have patients who have increased health literacy and satisfaction, it all again contributes to that adherence of care and follow-up, and the ability to kind of seek out help at the right times, ask questions when they need to. And all of this kind of playing a role, not just in the less uncertainty and risk for, the entire ecosystem here, but it also kind of does help, if we're being, very kind of deliberate on the cost side. It makes the whole process more efficient. And it also kind of assists with, reimbursement scores where, patient satisfaction and patient family satisfaction do matter. And Hans Fenstermacher, I will let you dive in here now with a very important kind of follow-up to that.
Thank you. And I was just about to jump in and remind everyone that, of course, language access for patients and clients is the law. And as many of you know, as most of you I'm sure are aware, Section 1557 of the Affordable Care Act states that care providers must seek an interpreter to guarantee proper communication, and they must do that at no cost to the patient. And in addition, the American Disabilities Act requires care providers to provide this communication accommodation for deaf patients, again, at no cost to the patient. So it's important to remember the really positive and sort of encouraging benefits of using language services, but also that there's in addition to that carrot, there's a bit of a stick here in terms of federal law requiring it. So what we'd like to do now is talk a little bit about, now that we've established the need and the importance and the value of the language service provision, sort of what are your options then if you're in the healthcare provider space, and talk a bit about how that looks. And from our perspective, we frame this in terms of what should a modern language service look like? How should you be able to make language service part of your workflow, part of your service in a smooth and effective way in today's economy and in today's technology environment? There's a few important aspects from our perspective. The first is that it has to be fast. We need to be able to access the language services quickly because everything is moving at a very rapid pace, and there's no time to wait for access to language. So it has to be available exactly when you need it and when the patient or client needs it. Secondly, in today's environment, it has to be ubiquitously mobile. Basically, the language service has to be able to move with the caregiver and the individual client and patient wherever they are. It can't be limited to a specific location or a specific spot in a practice or a hospital or an office. It has to be readily accessible anywhere where you may need to have it there. In addition, it needs to be unbound as much as possible by technical constraints. So it should be something that you can use with existing equipment. It doesn't require anything new to be added, that it doesn't have any infrastructure requirements for you to completely retool your location or locations. And to the extent possible, it should be technology agnostic, so that no matter what you do to update, upgrade, and enhance your technology services, the language service can move fluidly with you and keep up. In addition, for healthcare, of course, there are extra steps that language service has to take and that are required. The quality of the language service must be high. Obviously, this is a very sensitive area. This is a very highly specialized area of healthcare. So the interpreters and the linguists need to be qualified, and they need to be experienced and have a background in the subject matter that they're dealing with. And in addition to that, you want the delivery to have a mechanism whereby you can get constant feedback so that you're understanding how is it going from one implementation and one use to the next, so that you can and then take steps to improve the quality and keep the quality maintained at a high level. From HIPAA standpoint, we're all very well aware that there are very strict requirements regarding confidentiality of patient information and client information, and security around the data and the technology that is being used for the network that transmits these language services. So all of those requirements have to be met on a very strict basis. And then on top of all of that, of course, the TCO, the total cost of ownership of managing the language services needs to be affordable. It needs to be something that can be fitting into the budget of your network, of your location, of your operations. You don't want to have any wastage in the budget. You don't want to be paying for things that you're not using. And at the same time, it needs to be adjustable because circumstances will change. You will find different languages that may come into play. You may find volumes increasing and decreasing and things like that. COVID-19, is, if nothing else, as Kirsten has said, has shown us that the volumes can suddenly rapidly spike, and you need a language service operation and support that can take that into account and move fluidly with it. Now, in terms of the way language services are typically delivered, there are a number of ways that many of you are probably familiar with. And we've put them here a bit in the order of their existence, so to speak. The oldest form, I suppose, is what might be called in-person interpreting, or IPI. And that's the case where you schedule an interpreter in advance to be present at an appointment sometime in the future. That is a practice that's long been in place, but it has obvious disadvantages. When you need to schedule someone in advance, you're not meeting the modern language service delivery requirement of being available when needed. It causes huge lags and delays. If you instead maybe have interpreters who are on staff in your location or facility, that can work great and provide a better access and quicker access, but at the same time, that's not very budget friendly. That creates often a high cost of overhead and headcount that you may not be using fully to full capacity. Next, the option is over the phone interpreting, OPI. And this is provided a lot of advances and a lot of advantages for folks in the healthcare space, but it also has its disadvantages. Accessing an interpreter over the phone is typically a landline-based affair, meaning that the phones that are using the access to the interpreters are located in only certain places. That negates the advantage of being able to have access to the language service everywhere you go. You end up having to sort of get the patient or client gathered up together and move them down the hall in order to have a conversation around a particular landline phone that has access to OPI. Even in the days of modern special equipment with OPI, that creates disadvantages too, because having to now manage different kinds of, let's say, dual headset phones or other equipment means that you have a technology asset that has to be maintained. It doesn't fit into the technology platform that you have and becomes an additional burden on the operation. And the most modern, perhaps, delivery format for language service is video remote interpreting, VRI. And this has combined the next best thing to being there, which is being on video, along with the audio access, and has created a lot of advantages. But even there, typically, you see disadvantages with regard to special equipment that is needed. Dollies, for example, that have the VRI access on them that have to be moved around your location in order to meet the patient or client wherever they are. And that means that those two are not technology agnostic and become an operational burden. And in addition, there is higher cost associated with this technology solution, especially when equipment is involved. So it becomes a budget question again for operations for how to deliver language services effectively and cost effectively. Ultimately, what you would like to have is a delivery that is integrated into your telehealth platform. If COVID-19 has shown us that telehealth is now a vital piece of the delivery process for all of the services, and language needs to incorporate itself into that. It needs to be as accessible quickly and everywhere as possible. It allows you then, by virtue of that, to treat the individuals wherever they are. It can be part of your existing telehealth platform, so again, it doesn't create a technology burden or an infrastructure burden. And ideally, it only adds incremental add-on costs for the language service that you're putting onto your platform, so that you are being very cost effective in the implementation. And finally, you can unify your access and security and HIPAA protocols so that it's all in one kind of manageable location. And this is really the ideal way that you want to deliver the language service for your patients and for your clients. So we'd like to ask you our last poll question here with regard to the languages that you anticipate needing in the next 6 to 12 months. So I'm going to go ahead and share that poll. And if you can look down the language list that you see pop up in a moment and sort of check off the boxes that you think are languages that you're probably most likely to need as you go forward. I'll give you a few seconds to look at that list. And I'm sure there are languages that are not on this list that you will also need. We certainly would welcome you letting us know if you see languages, or if you don't see languages on this list that you think are important, because that is another aspect that we haven't gone into too much, but the availability of the right languages for the right patients and clients that you're treating. So I'm taking a look at some of the results that are coming in, and it looks like we have the Mandarin and Cantonese leading the pack, Mandarin more so even than Cantonese, and some the other languages a little bit further down the list. That resonates very well with what we have seen and heard from a number of other partners that we're talking to and customers that we're working with. I'm going to go ahead and close off that poll. Thanks for your answers to that. So basically, that's the information I wanted to share with you, and I want to hand it back off to Kirsten, who can close us out with a presentation of how we at Jeanie view the solution for this language service delivery problem.
Thank you, Hans. And as Hans says, very articulately, there are lots of different solutions, and not everyone has to kind of figure out what solution is right for you for all the different requirements that you have. And at Jeanie, we kind of looked at the industry. We're all language people on the senior leadership, advisory, and investment team. For the most part, we are tech people. And we've been looking at the language services and healthcare space for a long time. In the US, it's over $20 billion. Interpreting and technology and healthcare alone in the US is over $2 billion. And what we noticed was that there was a lot of, that most of the models out there were very capital intensive. You have a lot of call centers, you have a lot of dependency on different people standing by where they're not being utilized, and just a lot of, kind of expense in the models, which then have typically, resulted in poor compensation for interpreters, but also higher prices for customers. And so we had the luxury of kind of looking at this from a more recent modern perspective of a gig economy and saying, well, if we created the first and only currently language service provider in healthcare market as a gig economy, how could that change the way that we deliver services and the prices at which we deliver them? And so we are now connecting you to using your mobile device to a video or audio call with a live interpreter who is accessed through our community of HIPAA-trained, medically assessed and qualified language interpreters who are standing by basically 24/7 to be on that voice or video call with you and assist you. And just to kind of go through really quickly, some of the other aspects of Jeanie, we do offer Jeanie on smartphones and tablets, and a lot of that is to kind of really deliver that more mobile experience, and we can talk about those advantages. But we do see, the value and need for having a desktop version, and that will actually be coming out this summer. And so if you look at the different, things that we were, the aspects of delivering language service in healthcare that we were trying to kind of really achieve, we wanted to create something that was faster to set up and to use. So we didn't want these kind of, long enterprise cycles of multiple, days to kind of get your account set up, dealing with all kinds of salespeople and, huge contracts. We really wanted to make it very easy so that, if you've got 10 minutes, whether you want to do it over email or whether you want to do it over a phone call, we can get you set up and using the service right away. You could actually be using your interpreting service and talking to an interpreter within, a quarter of an hour. And we wanted to put this on, devices, equipment that you already had. We didn't want to make it so that you had to purchase new equipment. And the second component was really kind of making it easier to use. an elastic supply, a gig economy sort of model means that 24/7, we can connect you to these linguists of ours, these interpreters who have at least 5 years of experience doing medical interpreting. As I said, they're HIPAA trained, very kind of high quality people who have done this for years. And where there are certifications in their languages, they are also medically certified. Some language pairs, as you probably know, don't yet have interpreting certifications attached to them. But when they do, our interpreters must have them. And then we wanted a system that would connect you directly to an interpreter. You didn't have to kind of get on the phone, get connected to the call center. You have to remember, your account number. You forget your account number, you run down the hallway, you get your account number, and then you're sort of, waiting to be connected. And times can sometimes be prohibitive. And then the mobile technology, as you saw in the previous slide, on your phone, on a tablet, really allows the caregiver to go where the client is. So whether or not we are, in an office setting, or whether or not we're in a patient room, wherever, or if I need to go from the client or the patient into a waiting room to speak to a family member or a spouse, it allows me again to kind of take the interpreter with me where I go. And then finally, the advantage of an assetless model was that we were able to produce and are able to produce the least expensive video remote interpreting service in the market in healthcare right now. So our lower overhead means that we don't have to, charge kind of, enormous hospital prices, which makes us very convenient if you're not a huge hospital system like a MedStar or Johns Hopkins, but you're a clinic or a physician's office or a behavioral health agency, and you have, staff anywhere from, one person up to, 1,000. This makes it a very kind of much more convenient and affordable model to set up. The other sort of, pet peeve we have was around pricing models. When we looked at the industry, we sort of chuckled to ourselves because we didn't think you could make an industry any more complicated in pricing than the language service provider industry had done in healthcare. Different prices for video, for audio, for different languages, different times of the day, you name it, it's sort of a variability. And we just wanted to kind of make it very simple. So for us, we have same prices for audio and video as well as for teleconsulting, and we have same prices for all of our languages except American Sign Language, which is a little bit more expensive. And how it works, we designed Jeanie to be super simple. You download the app, again, on a smartphone or tablet. You create an account, which we help you to do. You open the app, you select your language that you need help with, and you tap video call or audio call, depending on whether you're looking for a video or audio. And in less than 30 seconds, your linguist is on the screen in order to help you to have a three-way conversation. And you can turn the phone around so that you can, if you're in person with your client or your patient, you can actually sit there around the device, with your client and have a conversation with the interpreter. You can also turn the camera around so that the interpreter can see documents, prescription pads, signs, etc., and to help kind of do real-time translation so that there's very, little miscommunication there. And a lot of the physicians that we have worked with and behavioral health agencies and caregivers, one of the pieces of feedback that they've commented on a lot is the ability to have that app, the Jeanie app, open on your mobile device, and it will stay open for as long as you keep it open. You'll stay logged in. You can even close out the app, but you'll stay logged in, and you don't have to keep logging in. You don't have to remember all those credentials over and over again. It keeps you logged in, and we are a HIPAA compliant platform. And we've just released one of the reasons why Credible invited us to share this information with you today is because working with them, we have now come up with an in-app three-way calling feature. And we did this because we've been obviously anticipating what was coming with COVID-19, and we wanted to give our caregivers the ability to teleconsult with clients and patients in a very affordable, safe, protected, and confidential way. And so now, if you are a caregiver and you open the Jeanie app, you would do all the steps that we just spoke about in the last slide, where you select your language, you get on a line with an interpreter, and then you'll be able to add in a patient call. And so you will click the plus button up in the other right-hand corner, and you place the call now to a patient. Now you, the patient, and the interpreter are having a call that is protected on a HIPAA-compliant platform. And what's important about this to note is in the three-way calling, that phone call to the client at the end, or the patient at the end, the individual, is actually just a phone call. So while the caregiver and the interpreter can see each other, it's still an audio call for the client. And the reason was, not all clients, not all patients have technology on the other side where they can actually welcome in a video call. And we wanted to make it so that even a landline number could still be called in order to access your client or your patient. However, as you see here, our mission is to kind of continue to pioneer and create state-of-the-art solutions. And in addition to the teleconsult three-way calling, and in addition to our healthcare for ASL, American Sign Language, which does allow for on-demand video interpreting for face-to-face communication between our deaf clients and patients and caregivers. Coming soon, in May, we will have Jeanie for group video sessions. And so in May, through the Jeanie app, you will be able to have up to 4 people on video inside of the app, and that would include your interpreter as one of those people. And then immediately thereafter, or shortly thereafter, I should say, we will be introducing Jeanie on the desktop version. But in the meantime, you do have the ability, again, to do the three-way calling with clients, with patients, and you can add as many people into that call from an audio standpoint if your client or patient wanted to add someone into that call as well. And as we are kind of coming up here, running out of some time, we wanted to kind of leave behind one important message. Well, there are 2 important messages actually on this slide. The one on the left, which is "Andre tutto bene," is a statement now that's been made popular by Italy going through the COVID-19 crisis, which basically says everything's going to be okay. And especially because so many of the people who are attending the call today give their careers and their lives to the behavioral health and mental health benefits of others, we also wanted to kind of chime in the spirit of optimism and hope, which we believe is the antidote really to all of the kind of trials that we're all going through right now. And it's a small contribution that we can make, but we want to be here to support and to provide. And for our Credible agencies, we are working with Credible right now and partnering with them to sign people up this month, where we are waiving all the subscription fees until June. And we're also offering 100 free minutes of Jeanie, which allows you to kind of, try us out and use it and see how it works for you. You just have to contact your PRM and get all the details. And for other healthcare providers who are attending today, we have other April discounts that are also available. And it's really, again, our effort to try to make sure that the one thing that's not standing between any of you and success with your clients or patients right now and their healthcare, their needs, is language. We want to make sure that we've eliminated that barrier. So you can reach out to us here at contact information here at healthcarejeanie.com, and we can give you additional information as well. So thank you very much for your time today. I know we are kind of running up right against the 2:45, but we're happy to hang out here for a few minutes and take a few questions if anyone wants to stay a little bit longer.
Let me just say thank you so much, Kirsten and Hans, for giving us such an informative presentation. What an amazing product you have, and great offers as well. Really appreciate it. I thought I learned quite a bit more about you guys, and I thought that was really helpful for everyone. At this point, there are no real questions. That could change in just a second now that I've said that. But just in case you're interested, a couple of people did say for the last poll that the languages that they also need are Indonesian, Nepali, and Creole. So just a few things to make note of. They were kind of suggesting that it wasn't in the poll, but they wanted to make sure that they were heard. So I wanted to throw that out for you guys. So thank you to everyone who did jump in there and let me know the additional languages that they were looking for. I'm just looking to see if there are any more questions. I think we're probably okay. I don't see any more coming through right now. So again, thank you so much for your time, both of you.
I'll just jump in to address the other languages really quickly then, since there aren't any other questions. But just to kind of let everyone know that naturally we have languages on the platform that you get on demand. If you have kind of less commonly taught languages, as we call them, that are a little bit more infrequent or rare, we have the ability to kind of pre-schedule any of those languages so that we can get a HIPAA trained, medically certified person who speaks that language online for you when you have those appointments coming up. So we can make that happen. But we do rely on our partners to really kind of drive the demand for which languages you want to see on our platform. So that kind of feedback is especially helpful, and we appreciate it.
Well, that's fantastic. And Lou just jumped in and said Arabic or other Middle Eastern languages would also be helpful. So obviously they can contact you at healthcare@jeanie.com to look into that and to get you get something scheduled to talk about it. There are no other questions at this time. Again, I want to thank you very much, Kirsten and Hans, for giving us your time and such a great presentation. We're pleased to have you. I do want to mention to anybody else who's on the call that is interested, obviously we have recorded this. For our partners, we will be putting this on our LMS, and that'll be available by the beginning, should be Monday afternoon of next week. And then, of course, you can contact Jeanie if you're not one of our partners to find out how to get your copy of this presentation if you happen to miss a few parts at the beginning. Again, thank you so much. Have a fantastic day. Have a fantastic weekend. Stay safe, everybody. And thanks again, Kirsten and Hans.
Thank you, Jason, and thank you, Credible, and thank you, everyone, for attending today. Everyone stay healthy and have a good weekend.